Download our app available from the App Store and Play Store. Hello and welcome to Medical Dialogues. I'm Roshni Dhal. Let's look at today's daily bulletin. Through recent notice, Medical Counselling Committee has informed about the addition of 156 MBBS and BSc nursing seats in round 2 of NEET Counselling 2022. According to the notification, 90 MBBS and 66 BSc nursing seats have been added to the round 2 seat matrix. For more details, you can check medicaldialogues.in. Coming down strongly on doctors, health workers as well as the government in the case of the death of a female patient who was apparently carrying a dead fetus in her body for 5 days and later passed away, the Odisha High Court has issued a series of directions in a medical negligence case. The bench of Odisha High Court issued directions to the state government to take strong action against the errant doctors and provide compensation of rupees 10 lakhs to the family members of the deceased patient due to the negligent and careless attitude of the doctors, and constitute schemes and policies for the pregnant women concerning the issue of maternal deaths. The case concerned a deceased pregnant lady who apparently carried her dead fetus in her body for 5 days due to the lack of care and attention of the treating doctors and hospital. Air pollution in India, national capital and NCR region has been affecting the organs of the people, said former director of AIIMS, Delhi, Dr. Randeep Guleria. Dr. Randeep Guleria, who is also HOD of the Department of Pulmonary Medicine and Sleep Disorders, while speaking, said it is causing more disability than even tobacco smoke. We talk a lot about smoking but not about using tobacco, but now the burden of disability has shifted more towards air pollution. The latest developmental drugs, particularly for the use in oncology, rely on the targeted degradation of harmful pathogenic proteins. In a recent study, researchers at CEMM, the Research Center for Molecular Medicine of the Austrian Academy of Sciences and the University of Dundee in UK, identify potential resistance mechanisms and provide insights on how to overcome them. Traditional targeted cancer therapies mainly rely on drugs that bind pathogenic proteins and inhibited their function. The latest development of drugs has brought forward chemical molecules known as degraders, which force the targeted degradation of disease-relevant proteins. This method of targeted protein degradation is not only more efficient but also better at overcoming potential drug resistance.
As the air quality index in Delhi touches the 500 mark, concerns about its grave health implications also go up. We all know how air pollution is damaging for our lungs and respiratory system in general, but new research by the American Society of Nephrology has identified that among adults with normal kidney function, exposure to higher concentration of components of air pollution was linked with higher risk of later developing chronic kidney disease. Chronic kidney disease, also called chronic kidney failure, involves a gradual loss of kidney function. Your kidneys filter waste and excess fluids from your blood, which are then removed in your urine. Advanced chronic kidney disease can cause dangerous levels of fluids, electrolytes and waste to build up in your body. Several reports have described a relapse of certain autoimmune kidney diseases in patients after they have received COVID-19 vaccines, but it's unclear if this association is real or just a coincidence. In a recent population-level study published in JASN, investigators found that a second or third dose of COVID-19 vaccine was associated with higher relative risk but low absolute increased risk of disease relapse. As vaccination programs were rolled out, individual case reports began to emerge, describing flares of glomerular diseases that occurred within days to weeks of COVID-19 vaccines, suggesting the vaccine itself may have induced a flare of the autoimmune kidney disease. Problematic alcohol use is associated with increased odds of suicide or self-harm, according to a new study led by UCL researchers. The study did not identify a clear association with levels of alcohol consumption and risk of suicide or self-harm other than among those with probable dependence. Rather, they identified signs of alcohol negatively impacting people's lives as risk factors. The study involved 14,949 people, broadly representative of the general public in England, who completed surveys about alcohol consumption and patterns of harmful use. The researchers compared this to self-reported incidents of suicide attempts, suicidal thoughts, and non-suicidal self-harm in the past year. A team of researchers at the University of Missouri have identified the specific mutations in the monkeypox virus that contribute to its continued infectiousness. The findings could lead to several outcomes, like modified versions of existing drugs used to treat people suffering from monkeypox, or the development of new drugs that account for the current mutations to increase their effectiveness at reducing symptoms and the spread of the virus. The researchers analyzed the DNA sequences of more than 200 strains of monkeypox virus spanning multiple decades from 1965, when the virus first started spreading to outbreaks in the early 2000s and again in 2022. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.